Talking now about people who are fighting a lifelong battle against addiction and substance use disorders. Of course, that is an intensely personal journey, but there's an irony to that because it's a journey at one time when you're not always so sure about trusting yourself. So you could use all the help you get, including some new innovative tools that are being developed right here in Connecticut. And joining me to talk more about that, I'm happy to have back on the show the medical director of Rushford, Dr. Craig Allen, and welcome to the show the founder and CEO of Tricycle Data Systems, Mr. John McBeth. Mr. McBeth, pleasure to meet you.
Thank you, Tim.
Doctor, good to see you again.
Good to see you again, Tim.
Yes, please start by talking about that irony there, that people have to do this themselves, but they can't necessarily trust themselves.
Well, you know, we have evidence-based treatments that are effective. They work. Medication-assisted treatment for opioid use disorders. When people are in our programs, like at Rushford, they do well. If they're in our residential program, if they're in our outpatient program, when they're sitting in front of us, they're doing great. But there's still such a high relapse rate. So that's what we're trying to focus on. And when someone comes to my office, I say, you know, how did you do? And they say, well, I was doing good, but I was tired. I wanted to decrease my medication. I know I didn't call you, but then a friend of mine showed up, and I had a fight with the wife. And I said, wish I'd have known that then. Maybe we could have gotten in there and done something. So we talk about signs and symptoms of relapse, and we focus and try to work on that.
Okay, so how did this partnership then come about?
Excuse me, Tim. We've been working on the system for about 7 years, and what we did is we took a diametrically different approach to the problem. So what we did is we reached out to Hartford Healthcare in 2013, started to create the relationship. For us, it was all about looking at different ways of being able to deal with the issue, diametrically different. In particular, we started to learn that addiction really has a lot to do with community, and making sure that we could find ways that could empower people to connect with their practitioner.
Right. So
the system is really designed to help the practitioner learn more about you when you're not in the meeting room.
Okay.
So if somebody like Dr. Allen has data on that patient for 30 days, and we can start to use predictive analytics. We partnered with IBM and IBM Watson, and we're learning an enormous amount about behavior. And when we learn about behavior, then we can start to predict, and then we can start to intervene.
Yeah, I get that sense that people are all individual, but when you look at them in the aggregate, you can start predicting behaviors just through probability. And I imagine this is, you mentioned it being diametrically different. I imagine that is trying to be proactive instead of reactive.
That's right.
Yeah.
You know, the way things operate currently is we are relying on our patient who has a chronic disease, and the disease is of the brain. We're relying on them to catch themselves and identify when they're in trouble and reach out to us. But they're in the throes of these powerful forces that cause a relapse and drive a relapse, and they're not reliable or able to reach out sometimes.
So we're almost out of time. I know this is still in development. Where are we in the development process with this, and when do we think we're going to have more of a finished product, if it's not already finished?
It's finished now.
Yeah.
We're extremely proud to be working with Hartford Healthcare, and in particular Rushford. We're in deployment with 3 different projects right now. One of our key partners is Project Courage down in Old Saybrook.
Sure.
They've been absolutely fantastic, and we've actually got data that's intervened with 2 cases already. So we're actually starting to see that now that the data is driving a change in behavior at the practitioner level.
Oh, isn't that great? You see those commercials for IBM Watson and all those predictive analytics. This is evidence that it's actually happening. That's great news to hear. Guys, I hope the partnership continues to pay dividends.
Yeah,
a pleasure to meet you, Mr. McBeth. Doctor, good to see you again as always. Dr. Craig Allen from Rushford.